Greetings, everybody. Xavier here with the Barbara Cares Foundation. I am excited today. We are here in week number 2, and I have a special guest for you all. I am honored for the opportunity to interview with Ms. Deidre with Your Nurse Advocates. And today we are going to be discussing resources that are available. As you all know, the story with my mother. It was a hard journey for us as she was battling breast cancer. And one of the things that really was difficult for us was to be able to find resources here locally that were able to assist her, answer questions, and just be a support for both of us as we were going through this journey. And so, having said that, having walked that path, we have resources that are available. We want to educate you, we want to inform you, and most of all, we want to let you know that we have help that is available for you. So without further ado, we're going to do an interview type format today. And Ms. Deidre, first and foremost, how are you doing today?
I'm doing great, and I'm super honored to be here today.
It is always good to see you. I tell you that you are just a wealth of information, and I count it a blessing to be able to bring you as a part of this 5-week Broken Silence Awareness Campaign. As I mentioned, we are in week number 2, and we are discussing resources that are available. If we can start off by just discussing what is Your Nurse Advocates?
Well, great question. So, your nurse advocates, we are educators, advocators, and navigators for families and their loved ones who are just confused by the healthcare system.
Mm.
So, we're kind of like a business consultant, but more on the healthcare realm. So, we help families understand their loved one's medical journey, what is going on, what's next. Do you understand your medicines? Do you know how to talk to your doctors? Do you know what questions you can ask your doctors? You can fire your doctor. You can hire a new doctor. So we help people along the way in their medical journey where the gaps are needed.
If I may ask you, why is it important to have a navigator to be able to be in your corner as you are navigating, if I could use that term again, as you were going through as far as a medical diagnosis? What is the benefits of having a navigator and utilizing a service such as yours?
Well, I'll tell you a story if I may.
Yeah, absolutely.
So with my mom, when she became ill, she was about 52 in that area. So I have me, I'm a nurse working in a hospital at the time. My other middle sister is also a nurse, but she's a teacher. So she was working with her students. And then my baby sister, she works in auditing for insurance companies. So she audits insurance companies. And everybody has husbands, kids, wives, basketball practice, football practice, life in general. When mom got sick, it was a lot of care and coordination to be able to make it to all 5 of her doctor's visits that didn't occur at the same time, nor do the doctors have the time to talk to one another. So it was a lot of juggling around of schedules. Can you get off of work? Can you take mom? Can you go to the doctor with mom? Which doctor is this time? So it is super important to have a patient navigator on your side because you have no idea what's next, what resources are available. Do my mom even need those resources? Does my dad even qualify for those resources? I didn't even know that service existed. So it's just so much that goes into play when someone's getting through the healthcare system. It's complicated, it's confusing, it's frustrating. So in order to have somebody who's truly on your side, that would be a private patient navigator or advocate.
You are definitely right. It is definitely a challenging experience. And if I may add, it's very overwhelming for those that have no idea how the health process works, how medical billing works, just being able to find the right doctor. It is a very uncomfortable, very overwhelming scenario that far too many of us find ourselves in. I do want to circle back on what you mentioned as it relates to a medical binder. What is a medical binder? I love that term, but what is that?
Wow. So a medical binder is your empowerment tool. I really feel like a lot of people are going digital, digital, digital. But what about the generation who is the baby boomer generation. What about them? What about them not being able to navigate the digital world? And then on top of that, so many physicians are on different portals, and the
Right.
portals don't talk to one another. So that makes it even more confusing. What if you live out of town and you have no clue what's going on with your loved one because they have 2 or 3 different doctors and they're all on different portals or different hospital systems? So your
Right.
medical binder is basically your empowerment tool that you can have in your hand that has all the documents that you need that for any healthcare provider that's involved in your care, whether it be your pulmonologist, your cardiologist, your primary care doctor, your physical therapist, your nutritionist, your podiatrist, whatever pertains to your healthcare journey can be in that medical binder. You can keep it in one place so that if your loved one happens to go into the hospital, unfortunately, you have a designated person that goes and gets that medical binder so they can tell the hospital about their medications that they're on, because the hospital's going to change. Or you can have that will or that healthcare power of attorney or that advanced directives in that medical binder for copies for your healthcare professional team. So it incorporates so much, and it's very extensive, but I think it's super important to be able to say, oh, I know where mom's advanced directives are. Here they are. Oh, I know where mom's list of medications are. Here they are. They're all in that medical binder.
And as you were mentioning that, that's something that would have definitely benefited me. As I said, when we were going and handling as far as with my mother, with all of her various doctor's appointments, she had specialists, she had follow-up appointments, and I tell you,
Yes.
it was challenging to keep up with who is this doctor? Like, what do they do again? They said that she needed to do this routine compared to another doctor that said this routine. And so, what you were mentioning, just having all of that information at my disposal, that would have been extremely more easy and convenient for us as we were going through those doctor's appointments. Or for someone that is asking and saying to themselves, wow, that's a great idea. Where do I start? What would be some practical ways that you would educate someone on how to get set up with the medical binder, the items that are needed, and when is it appropriate to begin to put together that information?
I think it's appropriate during these holiday seasons that are getting ready to come up, because everybody's going to be all gathered together. You can have these conversations that need to be had. Lots of times you go and you visit your parents and you're like, mom, dad, what's going on? So I think the most appropriate time is like at family gatherings, Sunday dinner, Christmas, Thanksgiving, all that's coming up. So that's a great time to do that. And if you don't know how, well, number one, it's very simple tools. You can get a 3-ring binder, and then you can get some inserts, and you can those dividers can be according to what you think should be in there. Now, I do have some suggested tips and binders that, inserts that should be in your binder from a healthcare professional standpoint, because we look at it a different way than a layperson would. As
Okay.
a nurse or a doctor or a physical therapist, we put together a special team of people who said, I would like to see this in that binder for the patient that I'm taking care of. So we are also going to be teaching classes in the near future, starting January, on how to build your own medical binder. But if you want to start early and start now, get that 3-ring binder from the Dollar Tree. Go and buy some inserts or dividers to put them in there and split them up for your medications, your doctors, your labs, your procedures, doctor's notes. So you can incorporate quite a bit. So our classes will be pretty extensive and intense, but it starts with you. You can always go and start today.
And I love what you mentioned, and I appreciate you giving some practicality to it in some real life situations. And you're absolutely right. We have the holiday season that is approaching, and as we're sitting down, fellowshipping with family, with friends, what a better time, what an opportune time to
Yeah.
be able to discuss matters relating to our health. And I know that health is one of those topics that, and you probably can agree with this, health is one of those topics that we tend to shy away from as a community. And so for us, it is important for us to be able to have open, honest conversations and dialogue so that we can go ahead and put those foundational pieces in place so that we won't have to stress and worry if the time does, heaven forbid, if the time does come to where we need that information at our disposal. If you don't mind me asking, as far as the extent of the services that your company provides, what are some of the highlights that you have that are commonly requested through your nurse advocates?
Attending doctor's visits with my clients.
Okay.
That's where the communication can and does get lost, especially in our season of COVID, when only one person can get in. You know, the numbers are going back up, unfortunately.
Right.
And taking somebody with you, having an accountability partner, a second set of eyes and ears. I think that is so important. I tell people it's like this, like say you were going to look for a house. And you're going to take a buddy with you because your buddy is going to see and notice things that you didn't notice, right? So to take someone along with you, such as an advocate or a friend or a family member, make sure you take them along with you and kind of discuss what's going to be asked at that doctor's visit. I call it pre-planning. So you have your pre-planning period, you have your doctor's visit, and then you have your post-planning period. Because so many people say, oh, I'll take notes at the doctor. But do you take the right notes? So that's another thing we teach our clients is how to take those notes. What are you going to ask at that doctor's visit so we can focus in and value your time as much as we value the doctor's time? Do you understand your medications? You've been taking your medications for years because you have high blood pressure. Is it still working? So we teach you how to document accordingly for your medications, your procedures, your disease processes, how they affect you. So that's why I say we're educators. We educate the family and the family members on, you know, what is your focus? What are your goals and how we can help you iterate those goals to the doctors. We're advocates. We can speak up for you when you can't speak up for yourself. And we're navigators because sometimes 3 months, 6 months, 9 months down the line, you don't know what's coming. And so sometimes as a nurse, I can see, oh, you're probably going to need XYZ services. And you don't even know you need XYZ services yet. So we can start vetting those now. So we teach people how to interview home health companies. We teach people how to adequately look at research studies before they pull them up and take them to the doctor. That's super important. But my most favorite is sitting with someone, collaborating with them in their physician at www.yournurseadvocates.com, or they can call for a free 30-minute phone consultation. Call and set that up at 817-854-3240. In addition, I have a YouTube channel. It's just Deidra Kindred. That's D-E-I-D-R-A, last name Kindred, K-I-N-D-R-E-D. Or I have a podcast called Your Health Chats Among Friends. That's what we call it. So that's where I bring other industry, my tongue is getting tired this morning, industry professionals from with a healthcare background to educate the community on the services they provide, the resources they have, and the communities they serve. I serve the Dallas-Fort Worth area right now. I am one of 3 individuals who are doing private duty patient advocacy. So we are out here and we're rocking and rolling.
And then my final question for you, and again, thank you so much for giving your time. What final words would you advise for those that are a little hesitant for seeking out a navigator or even an educator as it relates to matters of their health? As I said, this PSA is 5 weeks where we have candid conversations to be able to break taboo, some of the topics that are typically not addressed. And so we want to be able to inform people that it's okay to ask questions, that it's okay to seek resources. But what would be your final thoughts on those that are hesitant for getting screened, going to doctors, and even getting an advocate such as yourself?
Oh my goodness. we have to get over that fear of thinking that we're going to be mistreated off the back. Now, I know there has been some occasions where we have been, but we have to be responsible for our own actions, right? And it's not what you say, it's how you say it. So lots of times when we have questions and things like that, it's about getting that respect the same as we give it. So I say to people, reach out. Don't be afraid to ask. Don't be afraid to inquire, and don't Google medicine. But I do say,
that's a good one. That's a very
just
good one.
don't
Yes.
Google medicine. What happened to Uncle John and Aunt Kathy is not your story. So reach out to find out about someone who can provide you some services, because you don't know unless you ask.
I think that is practical advice, is sound advice.
No, I just want people to be empowered. I want people to feel like they can pick up the phone, talk to somebody, ask about the resources. If you can't afford someone's services, don't give up. There's resources out there that are nonprofits, such as your wonderful services that you have. There's help out there, but we just gotta seek, and then we'll find the help. Biblical.
I think that's good. So thank you again, Ms. Deidre. Everybody be on the lookout for week number 3. We are going to be discussing healthy eating, healthy living, and how to care for your temple. Again, Ms. Deidre, we appreciate you, and we certainly thank your nurse advocates for everything you do to promote health and wellness here in the DFW Metroplex. And until we meet again, we're going to sign off. And in the words of my mother, I tell everybody, continue to fight, continue to smile, and continue to fight some more. Talk to y'all soon.
Thank you.
Thank you.